All right, good morning. Thank you for joining us today on this Friday. We have Ms. Anissa Garza, and she's a coordinator for Doctors Hospital at Renaissance, the stroke. Hello, and she will be sharing some very valuable information about everything in her department. Again, we're very thankful for DHR partnering with us, Region 1 Education Service Center. I'm Isela Herrera. I am the specialist working with the PATHS project. And so here we are with Ms. Garza, and we're going to go ahead and let her take the spotlight so that she can share all her expertise and knowledge with us. Thank you so much for joining us, Ms. Garza. The floor is yours.
Thank you. Thank you all so much for joining this morning. Again, my name is Anissa Garza. I am the stroke coordinator here at DHR. I've been a nurse for about 6 years, going on 6.5. And I've been, loving it. I've been enjoying it. I used to work on the floor as a floor nurse. I used to work at the bedside. I also used to work at a rehabilitation hospital, actually our DHR rehab hospital here for physical therapy, speech therapy, occupational therapy, until I actually found this role. So this role is actually very special. It entails a lot of different things. And so as a stroke coordinator, my role is to make sure that we are meeting all of our standardized practices that we come up with, following national guidelines and practices for stroke. So I am the one that makes sure that we're following all of that as a hospital, that our nurses, our doctors, and everyone's on the same page in regard to giving our patients the safest care, the best care, the fastest care. And so today we're going to be going over a lot of different things for stroke, the signs and symptoms of stroke, the risk factors, the different types of treatments for stroke. And I'm super excited to get started. And so we'll go ahead and jump right in. So I'm going to go ahead and share my screen. I do have a PowerPoint presentation for y'all that I'm going to go ahead and share with y'all. So I want to make sure that everyone can see this. I'm not very tech savvy, but let's try it out. All right, can everyone see this? I don't know how I can tell if everyone can see it.
Yes, we can see it. It's on our screen.
Okay, perfect. So I'm gonna have to do it like this. I don't know if it will let me do it a different way.
You can press the little presentation at the very bottom of your screen, right next to the percentage, and it'll start a slideshow.
Okay, because it's starting the slideshow on my other screen.
Oh, okay, you have two screens.
Yeah, I have two screens. So I think this will be okay. If everyone can see this, we can just go ahead and jump right in. So DHR Health, as DHR Health, in our neuroscience division, we are a level 1 comprehensive stroke center. So what does that mean? We do have different levels of stroke centers. So depending on what kind of treatment you need for your stroke, that's the hospital that you need to go to. So as a level 1 comprehensive stroke center, that is the highest certification that a hospital can receive when it comes to strokes. So whether you're having a mild stroke or a really, really severe stroke, we are able to accommodate for any kind of patient coming in, and we have all the resources and tools available to treat any time of the day or night. So first things first, what is a stroke? So stroke is the leading cause of disability and the 5th leading cause of death in the United States. Each year, approximately 795,000 Americans will have a stroke. Every 40 seconds, someone has a stroke. So that's very, very important to know that it's very common. So this can happen to anyone at any age, at any time. A stroke is a certain type of brain attack. So instead of having a heart attack where there's blood vessels that are being occluded in the heart, the same kind of thing is happening but in the brain. So it can occur when blood vessels that carry oxygen and nutrients up into the brain is either blocked by a clot, which what we usually call an ischemic stroke, and that makes up the majority of strokes, or when a blood vessel in the brain ruptures, causing a hemorrhagic stroke. So those are not as common, but they usually do occur. The consequences of these strokes can be very, very disabling and can sometimes even cause death. So with ischemic stroke, so when they're caused by a thrombus or embolus that's blocking the blood flow to the brain, that's usually caused by really, really high uncontrolled blood pressure. So if you know someone that smokes, that has high blood pressure, diabetes, hypertension, things like that, that can cause a thrombus in the brain to form. Usually caused by really high blood pressure, high cholesterol. So if you have high cholesterol, plaques can form in those major vessels of the brain, causing that embolus, causing that blockage. Hemorrhagic strokes are usually caused by, again, really high uncontrolled blood pressure and or malformations in the brain where the vessels are already weakened, and or aneurysm. So if you can see right here, that little bubble right there that's hanging out the side, that can sometimes rupture, causing a bleed in the brain. So just to kind of give you guys a little bit of an overview of what a stroke is. So if anyone can name one side of a stroke, it's good to know the signs of a stroke if you do already. If you don't know any signs of a stroke, I'll go ahead and go over that right now also. So recognizing signs of a stroke. So when we think stroke, we have to think fast. So a stroke, when someone's having a stroke, it is a medical emergency. We have to act very fast. So just like someone may be having a heart attack, a stroke is the same kind of thing. We have to make sure that we're acting very, very quickly. So when you think stroke, you think fast, or be fast. So in this acronym, it's actually very easy to remember. So the F is going to stand for facial weakness, asymmetry, a droopy or uneven smile. A stands for arm or leg weakness. So you can ask that person to raise their arms or raise their legs. And if they do have any kind of drift downward in one of those limbs, that could be a sign of a stroke. If someone says, oh, I'm suddenly weak on one side of my body, they can't keep their balance, that could be a sign of a stroke. S stands for speech. So speech problems can occur. They can have slurred speech, trouble speaking, trouble understanding, sometimes even trouble comprehending what you're saying. They may not even be able to repeat a simple phrase back to you. So if you say the sky is blue, they may not be able to even say that at all, or it might be jumbled. T is the most important letter in the acronym. T stands for time. So you have to act very fast. Again, communicating with 911 as soon as that person develops any of these symptoms, and to report the time of when that person was last seen well. So when was this person last seen at their baseline, or when did those symptoms actually start occurring? This is very, very important because when the patient arrives to the hospital, that time is really going to determine how and what kind of treatment we're able to provide that person. If a person arrives too late to the hospital after those symptoms begin, we may not be able to treat them. So that time is very, very important. And of course, communicating with 911. Since it is an emergency, we don't want anyone trying to drive themselves or a family member trying to drive that person, because actually treatment can be started right when the EMS personnel arrive, and they can actually begin treatment right in the EMS, in the van, in the truck. So it's awesome. They can start IVs for us. They can get an assessment for us. They can start doing a whole bunch of treatments that we are also able to use before the patient even gets here. So other signs of a stroke, so B stands for balance. So again, if someone gets up and they suddenly are leaning over to one side, they're not able to keep their balance when they're walking. E stands for eyes. So someone could have sudden blurry vision, sudden double vision, or complete vision loss. and that could be a sign of a stroke. So these symptoms usually occur very, very quickly, very rapidly, very suddenly. And so that's how you can kind of know. Someone can even just have very subtle confusion, sudden trouble walking, loss of balance, and again, a severe headache without a known cause. So that could sometimes be a bleed in the brain. Sometimes patients that come in with bleeds in their brain usually say that they have the worst headache of their entire lives. Sometimes they say it sounds like it's a thunderclap headache. That's kind of that term that we use. And so that's when that severe headache without a known cause will kind of give us an idea that they might be having a bleed in the brain. So what causes a stroke? We can know some of the risk factors that can cause a stroke. So the factors that we cannot change, the things that we are not in really control of are our age, our race, our gender, our family history, past heart disease or strokes. So those are some of the things that kind of predispose us. So if we have a family history, you know, if our grandparents, if our parents, any siblings have a stroke or a heart attack, you know, that kind of predisposes us to have one as well. But the things that we can change, the things that we can control will be the things that we really want to focus on to keep our hearts healthy, to keep our brains healthy. We have to be monitoring our blood pressure. We have to quit smoking if we smoke. Monitor our diets, making sure that we're not eating very, very high fatty foods. Physical activity, making sure that we're doing some kind of physical activity every day, even if it is just, you know, casual walking 30 minutes a day every day. That's going to really help our hearts and our brains. Monitoring our blood sugars. If we have diabetes, making sure that we're monitoring our diabetes, taking our medications as prescribed. And of course, our weight, of course, monitoring our weight, making sure that we are visiting our doctors every year, and that we're making sure that we're drawing the certain labs that we need to make sure that, you know, they're able to give us a good checkup every year. So those are some of the things that you can't change, some of the things you can change. But again, if you know someone that has really high blood pressure and they don't take their medications, or someone that, you know, has been smoking a really long time, or even if you live with someone that smokes, you know, it would be a really great thing to kind of give them this information and kind of tell them, hey, you know, let's try to walk every day. Let's try to, you know, eat healthy. Let's get a salad one of these days. So that way, you know, you can kind of help that person, you know, you can help yourself, you can help anyone that, by knowing the risk factors of, you know, what can sometimes cause strokes. So at DHR, again, we are a certified Joint Commission Comprehensive Stroke Center. So that means that we have 24/7 specialized stroke care. So again, anytime, day or night, we're able to provide that care for any kind of patient coming in with a stroke. We have a dedicated team of stroke professionals and personnel. We do have the fastest response time when you need it the most, and certified through the highest standards. So Joint Commission is one of the most well-recognized accreditation in, you know, in the world. They certify so many hospitals, and so we actually do have awards that we receive through the American Heart and Stroke Association for our measures. So if we do meet a lot of our measures here at the hospital, then we will get awards every year to kind of say like, hey, we do have you know, the best standardized care. We do have the fastest team and the fastest times. And so this is the kind of hospital that you want to go to when you're having a stroke. And that's kind of a pretty cool picture there also. So again, we do have our 24/7 neuroendovascular physicians. So what do they do? Well, they are actually able to perform a procedure. So if a person has a really big clot in the brain, so that's the ischemic stroke, right? So if they have that really big clot or blockage in the brain, they are actually able to go up into the brain and extract that clot directly from the brain. Okay, isn't that awesome? We have that here. We have that available 24/7. We have our neurology services. So our neurologists are able to be consulted when a patient comes in for a stroke. they will be the ones to make the decision on what kind of treatment that patient needs. Our neurosurgeons are also available 24/7, and they are also able to perform any kind of neurosurgery if the patient needs it. So if they have a bleed in the brain, then they are able to actually go into the brain and perform neurosurgery to stop a bleed or to mend a bleed if they have an aneurysm or things like that. So that's where like McDreamy, McSteamy, all those, Grey's Anatomy characters come into play. So that is our setup. And so here are some of our physicians. So we do have our neurointerventional radiologists. So these are the physicians that actually go in and extract that clot from the brain. Here are neurologists. These are the physicians that kind of make that decision if we need to give a certain type of medication or if they need to go for that certain kind of procedure. We have our neurohospitalist who's always there at the bedside. So he's there to make that decision as well. We have a pediatric and adult neurosurgeon. These are our neurosurgeons. They are able to go in and perform any kind of neurosurgery. They also specialize in spine surgeries as well. We do have our physical medicine and rehabilitation physician, Dr. Viswamitra, and Dr. Esteves is our clinical neuropsychologist. So we have incorporated all of these physicians to provide the best possible care that a person can receive coming to DHR. So it's really, really awesome that we have this great group of physicians to care for our loved ones and our community. So true or false, less than half of people having a stroke arrive within the time of treatment. So what does that mean? Less than half of people having a stroke will arrive within time for treatment. Something to kind of mull about. What do y'all think? True or false? I'm going to say it's true. So it takes the average American 12 to 24 hours to arrive to the hospital after symptoms occur. So half of the people arriving with a stroke, guys, only half of them are going to arrive within that treatment time. So it's super important to know that as soon as those symptoms start, you have to go to the hospital. It's better to be safe than sorry, right? Because you don't want to be left with long-term, lifelong disability or wind up even, dying from a stroke. So it's super important, and unfortunately, it does take the average American a long time to get to the hospital. Of course, here in the Valley, we have our mentality of, oh, I'm going to sleep it off. I'm going to go to sleep and I'll wake up in the morning. I'll go in the hospital in the morning, or, I'm okay. They kind of play it off. But as time goes on, sometimes the symptoms can get worse, and at that point, you can't reverse that. So the faster you're able to get to the hospital, the better chance we're able to provide treatment to where we actually can reverse some of those symptoms that are occurring. Okay? So the really cool thing that we have here also at DHR is this imaging. So when a patient comes into the hospital, we're going to take them straight to the CT scanner. So we're going to take them to this scanner where it kind of scans their brain, right? And so if you can see this little purple looking dot here, that's where the stroke is actually happening. That's how much brain tissue is actually dead. All this brain tissue, that little tiny dot right there, is the brain tissue that's actually dead. That's brain tissue that's not coming back, and we cannot save that brain tissue. But here on the right-hand side is the green. So you can see there's so much green on this side. This is how much of the brain that could potentially die if we don't treat this stroke. So if we don't go in and extract that clot, or if we don't actually go in and, give this patient a certain medication that they need, then, that's how much brain tissue that can die, and that's how much brain that could potentially be damaged, with a lot of disabilities, and, can also be very, very severe for that patient. So the faster we're able to go in and identify where this stroke is and take out that clot, this is how much of the brain we can potentially save. So it's awesome. This image actually can go straight to our phones. So whenever a patient actually goes to the scanner, this image is going to be sent to our phone. We can look at it right away, and we can determine what kind of treatment this patient needs. So I do want to try to kind of show you guys this if I can. It's a really cool video that kind of demonstrates the kind of procedure that we do whenever the patient goes for this procedure. So this is exactly what the physicians are doing when they go right inside the brain. So I'm hoping this works and y'all can see it. So let me see if it'll let me. Okay, so here it is, guys. So if you can see here, let me start it back over. As you can see, they're going to take this stent right here. They're going to lodge it right on the clot. They're going to stop right on the clot. Okay. They're going to take that catheter up first. They're going to extend that stent right on the clot, and then they're going to take it out. So it's exactly what they're doing in this procedure. So you don't want that big old hunk of a clot in your brain. You don't want that there forever. That's gonna cause a lot of damage to the brain tissue. So they're gonna stop the blood flow up into the brain, and they're gonna slowly kind of aspirate or suck that clot out. Okay, isn't that kind of cool? And so once they have the clot out, then the blood, they're going to close this little balloon here, and the blood's going to go all the way back up into the brain. So that's kind of neat. So that's that procedure, guys. It's super duper cool. So during that procedure, you can kind of see they take some images. They inject contrast up into the vessels. And as you can see exactly where that clot is, it's like right here, because you can see all this side of the brain isn't getting any blood, right? You can see that. In this picture in the middle, you can see where that stent is. So they've already brought the stent up into that vessel, and you can see kind of where they're lodging that stent right on the clot. On this side, this picture is demonstrating when they actually remove that clot, how much of that brain tissue is actually being restored by blood. See the difference? How much blood is being blocked off versus now all that side of the brain is being reperfused. So that is awesome. So I hope no one is squeamish in here, but I want to go ahead and show you guys some clots that we've taken out in the past. So in this slide, look at this. This is a really big clot. Actually, there's several clots here that they actually had to go in several times and remove. So some of these clots that we pull out can fit in the palm of your hand. And it's amazing to see how patients come in, they're not able to talk, they're not able to move one whole side of their body. And once we take out this clot, the minute we take it out, because sometimes they're awake during that procedure, they're able to talk to us. They're able to start moving their arms and their legs again, and they start to realize, you know, what had happened to them, and now they can kind of start regaining some of their strength back, some of their ability to speak back. We have another clot here that's about 3 centimeters long, guys. Isn't that something? So really, really crazy clots that we are taking out, and that we are really, you know, going in there and getting these out with those stents. So this is another video that I can show you guys. Let me see if I can try to show you guys this one as well. This one's pretty cool. So if you have an aneurysm, so remember how I showed you guys that little bubble in the vessel? So that's what that is. It's called an aneurysm. And so if it hasn't burst yet, some of our physicians can actually go in. So the same physicians can go in, and they can actually put a coil in that little bubble area, and so that way it doesn't burst. So that kind of prevents it from bleeding. So what they do is they take they puncture one of the major vessels of the groin. They take a catheter all the way up into the heart. Instead of stopping at the heart, like if someone's having a heart attack, instead of stopping at the heart, they're going to go up into one of the major carotid arteries of the neck, and then go right up into one of those vessels. So this is the same kind of procedure. So what they do is they kind of take a very, very small, you know, coil, I guess you could say, and so they just kind of start circling it around that little bubble, and so it kind of just makes a really tight kind of knot in there, and so that way no blood can go into that little pocket and cause it to bleed or to burst. So that kind of helps it, that kind of prevents it. So it's a very soft, a very smooth coil that fits right in there, and so that kind of prevents that vessel from bleeding. So that's pretty cool. So we do have that procedure. So if for some reason it does burst, let's say, you know, then the neurosurgeons will be able to go in right here and kind of patch up that bleed right there. So that's that procedure. So that's pretty cool too. And what else we have? Okay, so we have a dedicated stroke care. We have dedicated stroke care. So while the patients are in the hospital, we do start them on physical therapy right away. So if they do have any deficits, we're going to start them on physical therapy. We're going to start them on occupational therapy. Physical therapy kind of works from the waist down. Occupational therapy works kind of from the waist up. And speech therapy, of course, works for the speech. So if they are unable to talk, if they're still having slurred speech, if they have trouble swallowing or eating, that's where the speech therapist can come in. We do have a board certified neurointensive care. So we do have a certain unit where these patients are going to go. And so that way the nurses, the doctors, everyone specialized in this care. And that way they're getting the best care that they can possibly get. Again, I just showed you guys some of that minimally invasive surgery. And then again, we do have the only CARF accredited rehab, I want to say like south of San Antonio, with the only rehab exoskeleton. So it's really awesome because this exoskeleton, when I actually worked at the rehab, they had this for a short while I was still working there. And, you know, some of our stroke patients were able to use it. They were actually able, if they weren't able to walk at all, if they still had some of that weakness, this was really, really awesome tool that they could use to kind of regain their strength and to start getting walking again. So when before they couldn't really walk, they were getting discharged from the rehab almost walking with a cane or a walker. And so it was really, really great to see, these patients, how they improved with really, really great rehab. So we do continue with a lot of community outreach. So, we want to do as much outreach about this as we possibly can. We have billboards, we make commercials. So a bunch of the stroke coordinators from other hospitals in the Valley, we all get together. In this picture, we all get together and we try to think of ways that we can go out into the community, raise awareness, even to some of the more, lower income populations and things like that. We try to target those people. We do health fairs, anything that we possibly can. So we work really closely with EMS providers, fire departments, all of our first responders to make sure that they know exactly what they need to do when they're assessing patients that may be coming in with a stroke. We also will make sure that anything that they need to do. Sorry, I heard an echo. That anything they need to do before the patient arrives, that they can do that for us, and they can go ahead and provide us with that status of the patient before they even get to us. So we do, again, just do a lot of outreach. We set up booths out in the front lobby. So anything that we can possibly do to raise more awareness, not only to, medical personnel, but just to everyone in the Valley, anyone that can get this information. So this is just some of our teams, some of our physicians. We did get an award from the American Heart Association for our stroke program, and so we're super proud of this. We will be receiving another award, probably the same award for this upcoming 2020 year. So again, we're super excited. We take a lot of pride in taking care of our stroke patients, and we just want to make sure that y'all feel comfortable, with knowing what to do, how to recognizing a stroke, calling 911, making sure you stay with that person, you don't leave them alone, you call 911, call for help. If you can get CPR certified, I definitely recommend getting CPR certified. Try to do what you can to help that person, get to the hospital as soon as possible. So you are a stroke hero. Spotting a stroke fast is going to be the best thing that we can possibly do to save this person, getting them to the hospital, calling 911. So we do have some more resources. So if you're still interested in learning more about strokes or heart attacks, the strokeassociation.org has a bunch of resources, a bunch of tools. You can even go onto the American Heart and Stroke Association website. They have a ton of information. So if a family member has experienced a stroke, if you know of anyone that may be at high risk for a stroke, there's so many resources on there. There's support groups that you can reach out to for smoking, for, of course, stroke. So we do have a stroke support group here at our hospital at the rehab, and they meet the third Thursday of every month. So, for parents, for grandparents, caregivers, anyone who may be in need of some kind of support when maybe they're taking care of a stroke, loved one, or if you are a caregiver taking care of someone, that support group is also very, very, very helpful. So that's about everything that I have for right now. Thank you all so much, and I'll go ahead and leave some time for questions.
Yes, I have a question. Thank you for sharing all your expertise and experience. For some students, well, for all our students that are going to be watching this video, and some may be on right now, but they're probably asleep. What can they do to prepare? Yeah, what can they do now to prepare for this profession, and what kind of school are you talking about? Like how long and how many years did it take you and so forth? Can you talk a little bit about
Okay, that's a great question. Yeah, that's a great question. I knew from a very young age I wanted to be a nurse. I grew up around doctors, nurses. My mom is a nurse, my sister's a nurse. I have grandparents and uncles and just a whole bunch of family that was in the medical field. And so I immediately knew I was interested in doing that. Some people have different experiences to why they want to go into the medical field. I definitely encourage whatever kind of field of the medical profession that it is, you will be so essential to, taking care of people. So if you have that passion of, wanting to provide, everything that you can to help people out in your community, like, please, I encourage you to do that. I did my associates here in the Valley. I got my registered nurse here in the Valley at STC. So that took me 2 years to get my associates, and then I did my bachelor's online. So that was a really, it worked for me. We do have, UTRGV that has a nursing program as well. You can get your bachelor's. So there's so many different options that you can do. Schooling wise, you can always continue. So, you can start with an associate's, get your registered nursing license, continue on to get your bachelor's, your master's. You can even get a doctorate in nursing. There's different fields of nursing as well. So, just my knowledge based on nursing, you can get, an education background, an administrative background. So if you want to be a manager, in the hospital, a director in the hospital, those are some of the degrees that you can get. Doctorate programs, you can teach. There's so many different options that you can do as a nurse. When it comes to stroke, of course, becoming a physician, becoming a doctor, and, learning about the brain, that's amazing. I look up so much to our neurologists, our neurosurgeons, our neurointerventionalists that are able to perform these amazing procedures and save so many patients' lives. I know I only make a small difference, in this part of things. I'm kind of in the background, in the kind of hiding in the corner kind of thing. But I know I make a super big difference, even kind of in the background of things. I have to make sure that we're all doing our part, that we're all staying safe, that we're all providing the best possible care that we can for our patients.
Thank you for sharing. I typed something in the chat as well. What kind of courses do you recommend for students to be taking in high school to prepare for this? Any health profession?
So some courses to take, I would definitely get with like a school advisor. They can definitely help to get, let me see. What questions? Oh, okay. I see the chat now. They can definitely guide you. I was kind of lost when I first started. I was like, what do I take? I don't even know where to start. I don't know where to begin. But a lot of my college, professors helped. A lot of the advisors helped to know, okay, what do you need to take? You can take, pharmacology. You can take a bunch of lifespan courses. I think a lot of my prerequisites we're just kind of basic courses, biology, microbiology, chemistry, some of those. It kind of gets a little harder into like OChem and some of those courses if you want to go into like your master's and things like that. But I'd say, as getting through my prerequisites, for getting into the nursing program, they were pretty basic courses. Once you got into the nursing program, that's when you kind of felt the pressure. So in high school, I know that, in high school I tried to take as many AP courses as I could. I took AP biology, AP chemistry, any kind of math courses that can kind of prepare me. I know AP chemistry helped me so much in high school when I got to college and I had to take those really hard chemistry classes. That really helped me a lot. I took a lot of health courses. I tried to get into as much elective, health courses as I could. I know nowadays they have so many courses where you can get, registered in. You can actually, do rotations at the hospital. I know a lot of pharmacy schools and programs as well, that if you are interested in doing pharmacology or pharmacy schools and things like that, where you can shadow pharmacists in the hospital as well, even in high school. So I don't think I had the opportunity. I think it was just kind of starting when I was in high school. But that was kind of how I kind of got into, that kind of rhythm of, okay, I need to start taking some classes to kind of get my feet wet. And as far as clubs, I mean, I definitely joined a bunch of clubs. I joined a lot of like leadership clubs. I was in student council. I tried to do just a bunch of volunteer hours as well. I think I was in Leo Club. I don't know if they have those same kind of clubs now. But I did a lot of volunteering. I did a lot of, just trying to find everything that I could, any kind of resources that I could. I went to the counselor a lot. I asked them, what can I do? How can I, start to, get my feet going, kind of get my foundation started. Even in high school, I knew, just again, from a very young age, I had my heart set on that, and I did anything and everything I possibly could. To get into the best school, to get into the school that I really wanted to get into. Nursing is very competitive, and I'm assuming it is competitive with a lot of other medical professions, that, you needed to keep your GPA high, you need to keep your GPA up, you need to be in a lot of different clubs and programs, and, just dedicate a lot of your time. If it is a passion, that's something I recommend. Did I take college courses in high school? Yes, I did. I took just a few basic courses in high school. I want to say like economics. I took, I think, like a government class. I took, I think, a college algebra class. So I did take quite a few classes in high school. And so that also really helped me to where it kind of fast tracked my prerequisites. So I was actually able to finish a lot of my prerequisites before even applying into nursing school. So that really, really helped me a lot to be able to kind of have some time in there as well. I was able to work a little bit at the same time. So that was really, really awesome. To be able to kind of have that, one up. I didn't have to take a whole lot of college courses in college because I already had some of those under my belt. And I feel like that was really accomplishing even for me because, I, didn't really have that drive. In high school, it's kind of hard to focus on, you want to, still hang out with your friends and you still kind of want to enjoy the high school experience. But I think for me, it was really awesome because I was able to kind of balance all of that. And I still, kept my head focused and I still knew what I wanted to do in my life, and I didn't want to steer away from that. So I was able to kind of balance a lot of those things and just kind of make sure that I was on the right path for where my life was headed.
Well, thank you so much for sharing, Ms. Garza. Thank you for everything you do for our community. And we are very proud that DHR is very active right now, taking care of our community and our loved ones, because it's different being at home, but you guys have to be at work every day. So we thank you for that.
Thank you so much. Yes, and at this time right now, I mean, medical personnel, the ones that are working the front lines, of course, a lot of us can stay home and be in our comfy pajamas and kind of do our schoolwork and our work from home. But there's, those medical professionals that really put their lives on the line and are really going above and beyond to take care of everyone. And so we do have those same people here that, not only are they having to deal with this pandemic right now, but they're actually able to, treat strokes, treat heart attacks, treat all these other health issues that, are still happening, they don't go away, so there's still those professionals that, still have to work, they still have to take care of these people. And so that's why we're here. That's why we do what we do, because, in a time where, times are tough, we have to all stick together and work as a team. And, we just, we love what we do. And I don't think anyone, would say otherwise. I think we're all just working as a team and trying to, get through this time. So.
See, so they're showing their love on the chat. So thank you again so
Yes,
much for sharing.
thank you so much. I hope you guys really enjoyed this.
It was very informative, full of a lot of, we loved your PowerPoint,
Good.
and just thank you so much again for sharing. And on behalf of Region 1 Education Service Center, we thank you and we appreciate our partnership we have with Doctors Hospital at Renaissance and their staff. You guys are just amazing. So once again, thank you so much. And we will have this video available. So you may go viral. We don't know. But thank you so much again. Have a wonderful day, everyone. And we will see you next time on our cyber mentoring session. Bye-bye.
Yeah, thank you all so much. Have a good day.